Okay, so let's talk distributive shock. So distributive shock is just what it says. It's kind of like an all-over shock. The two most common causes of that are sepsis and anaphylaxis. So let's talk sepsis. So what sepsis is basically an infection that gets in your bloodstream and it goes everywhere. And when you're in distributive shock because of sepsis, you'll have excessive dilation of the blood vessels, decreased blood pressure, altered mental status, and a very high increase in lactic acid in your blood. So what happens with sepsis is the bloodstream detects that there is a pathogen in there, so it goes to extreme mode. So then it floods your body with white blood cells, and sorry, I have to get more control. So it releases all the white blood cells, and those white blood cells, think of them like an army. They're going to attack that invader, which is the pathogen, and then it's got weapons, which are histamine responses, and it'll make your body clot, and it breaks down, it attempts to break down that infection and pathogen that's in there. So sepsis, usually it can be caused by things like a urinary tract infection. It's very common for somebody to have the antibiotics aren't working, or they didn't get antibiotics in time, and then they get septic. And these people are very, very, very sick. They need a lot of fluid because of all that vasodilation, and the blood is not pumping to the organs and everything like it should, and then the organs start shutting down. So in the end, they're going to need 30 milliliters per kilogram of fluid, which is a lot, because our normal rate for fluid is 20 milligrams per kilogram, and then 10 milligrams per kilogram for a pediatric. But so what's going to happen is you'll see their blood pressure go down. CO2, which is my favorite, remember 35 to 45 is the normal CO2 range. Well, it will be very low because instead of CO2, it's got a buildup of lactic acid. So what happens is they start rapid breathing to try to get that homeostasis to even out the acid that's in the blood. And they will usually have a fever. They will be lethargic, low blood pressure. So what they need is fluid resuscitation. And for basics, if they are able to swallow and there's no contraindications, which you should all know from pharmacology, but you can give them Tylenol or ibuprofen if they have a fever. So again, sepsis, infection in the blood, white blood cells come, they start attacking, waging a big war. Your heart is trying to keep up with that, and then if that doesn't happen, then they can go into septic shock. And if they're in septic shock, then they are very sick. They need to be hospitalized. This is a lights and sirens kind of call. We have a sepsis protocol that if they meet sepsis criteria, which is low CO2, low oxygen, they have a fever, and known infection, then they get into the hospital ideally as fast as they can. The other one is anaphylaxis. Now, when we get into immunological disorders or immunological emergencies, we'll go way more into detail on that. But so anaphylaxis again is like an invader coming into your body. So that body senses that they're a bee sting or something. That body senses that there is an invader, and so it calls the army, calls that white blood cells, and they come and they release chemical mediators to try to mediate that invader that's in the body. So you'll have, that causes decreased cardiac output, and the blood vessels will actually leak from increased permeability, so they could get fluid or even blood. They're just tiny little tears that can get into their body. It also causes bronchoconstriction and spasms. And then you'll notice on the skin the urticaria, I never say that right, which is basically hives. So what do they need? They're going to need epi, they're going to need solumedrol, they're going to need Pepcid, which Pepcid is also a histamine blocker, and it really helps with the GI problems. A lot of times if someone's having an allergic reaction, they'll have a GI problem. Like fire ants. I don't know if any of you have been bit by fire ants. I know lots of people that have. I have. They seem to love me, but there's a chemical reaction of your invaders, and it messes with your stomach. And it's not a fun time. So Pepcid is for that. And Benadryl, did I already say Benadryl? Of course, that's a histamine blocker, so it stops that your body from swelling, because swelling is part of the whole histamine response. It's that sympathetic nervous system kicking in, saying we're in survival mode, and so you have to combat that. So we said epi, and that's 0.3 or a pediatric 0.15, and it's always IM. Used to be subdural, but it is not anymore. Always IM. Benadryl, we have liquid Benadryl if you carry pill Benadryl or IV Benadryl, and you can give them IM Benadryl. I mean, it's not going to feel good, but you got to get that in there as soon as possible. You got to fight that histamine response, so that way they don't go into shock. Just because they are in anaphylaxis does not mean that they're in full-blown shock. So how do you know that it's shock? I mean, they can be compensated. Like I said before, compensated. Your blood pressure is still okay. Your heart rate may be normal to a little bit increased. Respirations are okay. But if they're decompensated, they're going to be wheezing. You're going to hear stridor, which is like a high-pitched wheeze. They're going to have low blood pressure, either a really increased heart rate, or if they're really bad, then a low heart rate. And of course, low oxygen, and we all know what happens with low oxygen. We're beating this into your head, but we want you to know low oxygen means bad perfusion, which means things start breaking down, and it's no good. So of course you should do oxygen too, and you can give albuterol. If they have an albuterol haler for basics, that's a perfect time to give it, because that's a beta 2, so you want to open up those bronchioles to let that exchange happen. So that's just a quick overview of the shocks, and I appreciate your guys' patience with me trying to do this in between calls and everything. But read your book. If you have any questions, don't hesitate to call me. If you need, I will drive to where you guys are. We can talk about things, do hands-on. Other than that, keep up the great work.